pandemics like the HIV, and then we have H1N1, then bird flu, then SARS, and then now this coronavirus. And this coronavirus, this pandemic, this COVID-19, actually has devastated the whole setup of economy and social fabrics of the society, and that is why the impact created by this disease is very difficult to measure. But in future, maybe I think we'll have some estimation that how much impact it has created. And it was never thought of that we have such kind of vast impact on every sphere of life, not only life, but I think even the whole living structure of the human being. So it is an international issue, everybody understand. And this event, actually, if it does not have any international support, then you can imagine that such kind of epidemic or pandemic can create more havoc. And realizing this, the United Nations, particularly WHO, has come forward and start talking about that we should have this one health approach, and looking into this human health and animal health, and also the environment should also be part of it, including other sphere of life, including other sectors. So this World Health Organization, I think they have thought of that. Why not? We should have one special day for epidemic preparedness, and it's a welcome step. I'll not say that this is something not required, but it definitely required, because more and more disasters are coming, and we are realizing the climatic change leading to a lot of uh, problems. All kinds of disasters are there, and at the same time we have this biological disaster also, in which the pandemics are coming up, and more we are witnessing such kind of problems. So this international day actually uh, going to be celebrated every year 27th of December. And the purpose is that if we can have some kind of whole of the society, whole of the government, and whole of the world approach. So it's a new dimension has been created beyond one health approach, where every part and every segment on the globe has to take part in this preparedness. Then only we can curb the effect which can be due to these kind of epidemic and pandemics. Particularly when you are working in a local area, then you have to be strong in local area. Then I think it become easy to interact with the national and international level. Therefore, the epidemic preparedness is not always an international issue, but it's a at the same time the local issue. And the locally, if we are arranging our all the dimensions which are required for epidemic preparedness, then it become easy to look after the whole thing. So actually, when we talk about preparedness, I think we have very good panel, and these all speakers or maybe the panelists are going to elaborate on one aspect of the preparedness of the epidemic or pandemic at the local or at national or international level. But the most important part in this preparedness is the rapid response to any kind of epidemic or pandemic or outbreak. At the same time, we should have a public health infrastructure which is able to look after this rapid response. And at the same time, we have a very good risk communication. Beside that, the research and its utilization is also very important. If we are not doing good research, I think we may lack in our strategy in a proper manner. And the most important component of this is that the commitment of the political commitment, or whatever commitment has to come from various sectors. So the advocacy has to be done in this direction, and building the partnership. So these are broad areas of the preparedness where we are going to talk today. But when we talk about India, then you all know that government is committed, although for a long period we had not a very good you know very good system. But after the plague epidemic in India, the central government realized that we should have some system of surveillance, and that is why the Central Council of Health and Family Welfare, uh, in I think under the Ministry of Health and Family Welfare, they desire to establish the state and district level epidemiological unit, and that's a great move in 1995. And after that, they thought of that we should have the public health system strengthened to prevent the outbreaks. Later on, in 1997, we had this national surveillance program on communicable disease, and which was later on converted into IDSP, which I think today we are having this program. Initially, it was run in 101 districts, but later on, every district is now part of it, and they have the surveillance unit and rapid response team involving epidemiologists and then microbiologists and entomologists. Although these are very crucial, manpower, but we all know that they are not available all the time, all the districts, and that is why many a time we don't have very good manpower. And in this direction, the NCDC, previously it was known as National Institute of Communicable Disease, has done good job with the help of uh, WHO and also CDC. They have started programs. They have started short-term training program for 3 months, and then later on for 2 years course, and then MPH field epidemiology course. Although the takers are very less, but this was started. We are aware that there are some lacunas and some problems are there rolling out this at the national level, but efforts has been made by the government that how we can have very good capacity for surveillance in the country. This program require uh, special attention by the government, and this COVID-19 has again witnessed that we should have a very good system, very good IDSP program. And this whole pandemic should have, given the direction that every district should be strengthened to further strengthen IDSP. But we all know that was not done properly. But anyway, the program is running, and we have very good infrastructure now, and that need to be strengthened further. And we require, capacity building in epidemiology wherever possible. And are not only the Department of Community Medicine, but public health institution has come up in the country, and they are doing their job. And all international national organizations are working that how we can strengthen our surveillance system. And not only just, I think, for communicable disease, but non-communicable disease also they are giving attention, because they are coming up in a very huge proportions and causing more mortality and morbidity. So I just want to say that the efforts are being made, but through this kind of initiative by the WHO, UNICEF, and other organization, United Nations organization, they may further focus the lost attention in the direction of epidemic preparedness, because again I'll recall that we do not had the very good laboratory capacity when the COVID strike India. And then within a very short period, the emphasis was to establish a lot of laboratories where at least the diagnosis can be done. So definitely NCDC has play a role, but ICMR has chip in, and then we have this, Directorate of, Department of Health Research. Again, they have, many programs and many schemes are there where the lab can be strengthened. But lab without research funding and research collaboration development is not going to help. So we require cross-cutting research in various areas, and funding is required. And any collaboration with the international bodies is definitely welcome. So the cross-cutting means like not only just environment, or maybe I think climate, or it has to have a relationship with the human and animal health also. Then only we can have very good strategy and able to understand the interaction. You can understand that recently we had this COVID, the new strain. Immediately, world over we had a problem, and people are not able to. So if we have very good research, and India could have done similar kind of whether we have a new strain or not. So the such kind of research is required at the national level, so we can have very good risk communication to all the sectors and all the parties and partners. And then the most lacking part today, which I'm realizing, and even our three national bodies, the IPHA, IAPSM, and also the Epidemiology Association, Indian Association of Epidemiologists. I'm the vice president of that association. We realize that there is a lack of sharing of the information and sharing of the data. Otherwise, we could have utilized it in much better way. We were just, getting whatever coming in the newspaper and by the government body, but the raw data was not available, and we were not able to analyze it and then give some help to the government. So my talks is just initiating with the issues, and we have a lot of challenges. Particularly, still we don't have very good system of involving the private institutions. The funding is always a problem in all activities. We don't have very good funding. The political will is generated only during the epidemic and pandemic, and rest of the time it is not there. So we have challenge that how constant efforts are required in this direction. And then human resource development in epidemiology, particularly the field epidemiology, the practical aspect. We have hired so many epidemiologists which do not have very basic understanding of the disease, natural history of disease or disease pathology. So again, a problem. So there is a mismatch, and we require a lot of efforts in this direction. So these are all challenges. So we have very good panel, and I am happy to say that I have a long association with NIDM, and Dr. Anil, who is the first resource person going to talk about about the national preparedness of this biological, or say epidemic preparedness in India. So Anil is well known name, Anil Kumar Gupta. uh, he's a sustainability risk management strategist working in the area of disaster management, environment and climatic resilience for more than 25 years with the national and subnational, even business administration, and also international bodies. He's currently full professor and head of the India's National Institute of Disaster Management Division of Environment and Disaster Risk Management. So I request Dr. Anil to elaborate on the topic which is assigned to him.
Thank you, Professor Jugal Kishore sir, and being with you is always a pleasure, professionally and personally. And the same is with the COVID Academy, because COVID Academy has, by Spear India, has really done a marvelous job in bringing the important issues at the forefront, and also the series of this discourse. And today, which is basically the kind of a World Epidemiology Day. So what should I say? Should I say thanks to coronavirus, or what? Because now, because of this major disaster that we have been facing globally, now the emphasis on looking at epidemiological aspects and epidemiology as an important dimension in disaster risk management has been realized and recognized. Many of the delegates and participants would agree. If I recall, the decade of 90s, I think 25 30 years back, there was significant growth in recognition of the discipline of epidemiology and the environmental health and public health. But then it was given a back seat, and there were some other lateral issues which emerged. For example, the clinical dimensions and other things within the health. But uh, over the years, then again there is a paradigm shift, and people realized the need of emphasis on holistic health. Uh, uh, and if we talk of the dimensions of epidemiology, and how it is important for disaster risk management, and how disaster risk management looks at these dimensions, as the disaster episodes are, in fact, if not as major hazard, but certainly as the major contributors to the social vulnerability also. So there are various dimensions when we study epidemiology. Then we take cognizance of various lateral dimensions, which are otherwise also very central in the disaster management schools. For example, the environmental issues, behavioral dimensions, then resources, then the dimensions of toxicology, cause effect relationship. So these kind of dimensions, and a relationship between with a number of climatic and non-climatic factors. So that has a linkage with the overall disaster management also. Just 1 second, just 1 second. हाँ भैया, आप आ जाइए, आप आ जाइए, आप आ जाइए, आ जाइए। हाँ हाँ, 203, 203, ठीक 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 ठीक। And if we look at past 15 years, so although in India we had in endemic natural disasters, but these epidemic dimensions, disaster epidemiology particularly, is these dimensions are otherwise also touched significantly in various other guidelines also. For example, the guidelines on urban flooding, guidelines on drinking water supply during disasters, guidelines on floods, drought, cyclones. So the epidemics in the major form itself can be a disaster, but it can also be a cross-cutting dimension in dealing with other disaster risk also. So this is one dimension. But other dimension is that if we make a quick review of past 15 years, we find that the type of disasters have undergone significant change. Now, in fact, we never thought that air pollution will be treated as disaster, but now we are required to treat air pollution as major health emergency, or sometimes as a disaster. With the increased impact of climatic change, and otherwise also without the impact of climate change also, there is a significant change that has taken place in the type of disasters. Now, in fact, India has taken this issue also very seriously, for the intentional or unintentional, or maybe because of the technical mishap, or maybe because of any natural disaster, water contamination emergency takes place. So uh, 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 biological or chemical. So these kind of dimensions are very important, because we have these festivals and occasions where large congregations on the bank of rivers are, for example, Kumbh and Magh Mela. These kind of incidences are water sports. These kind of things are involved. So various impacts, climatic impacts, environmental risk, and a number of environmental emergencies which are now taking the form of disasters. Then, in fact, maybe we are not taking the thing as a very big challenge, but very shortly we may be required to discuss on this, that e-waste, because our entire life, all the aspect of our life is going to be surrounded, and otherwise also now it is already surrounded by the electronic gadgets. So a lot of electronic waste and these kind of things. So how new forms of epidemiology. When we look at disaster management, so there are broadly we divide that natural disasters, although now this kind of classification is obsolete, but we say some natural disasters and some technological or anthropogenic disasters. But epidemiology cuts across. For example, we have a subdiscipline like industrial epidemiology. There we discuss even the occupational issues, chemical industrial accidents also that causing a lot of burn injury and toxicological impacts and these kind of things. Then environmental epidemiology, water and sanitation issues, which are one of the prime concern of disaster risk management, particularly in the urban area, and also while we talk of linking rural health programs with these disaster management. Then disaster epidemiology, when we say that how disasters are going to create or alter disease patterns, and then on the other hand, how the major health episodes can they take the form of disaster. For example, what happened in this coronavirus pandemic, which is a kind of a black swan event. Black swan events are like very rare, so possibility is very less, but is still believed to be possible. And when it occurs, it can have devastating impact. So low frequency, high intensity kind of thing. But on the other hand, when we want to mainstream epidemiological dimensions into disaster risk management, and vice versa, we cannot ignore the lower order risk also, because order risk are equally important, because those are have two significance. One, they are major contributors to the vulnerability of the people's health, people's capacity lessons. And on the other hand, those are also the kind of early warning indicators. So if lower order risk are lower, small episodes are taking place, whether any kind of a viral attack or dengue, chikungunya, so that is indicating some kind of a requirement of relooking at our approach to dealing with these aspects, disaster management as well as the health intervention side. And at the end, I would like to say that now, in fact, we have a more than 35 years of journey in disaster management, and similarly had a number of paradigm shifts in the health system management also. And as Sendai framework, in its preamble itself, has given emphasis on health service improvement to reduce disaster related mortality and morbidity. I would recall that we would need to look at more integrated approach of planning as well as implementation at the local level. That is important because we will need to talk to the environment and climate change department. We'll need to talk to the health related department. Then we'll need to talk to a number of supporting infrastructure system. For example, electricity supply system, waste management system, and a number of other resources to make our hospital system also functional. And so disaster management, climate change, environment, and health. I think some kind of this thing would be required, and the same kind of integrated understanding at the level of community level institutions, and also in PRI and in the working of NGOs also would be required. With this few thoughts which I wanted to share at this occasion, and I'm very happy that the subject of epidemiology is now being recognized as a very important dimension in disaster management and overall dimensions of sustainability and safety. So this is very important. Thank you, Professor Jugal Kishorji. Over to you.
Nilji, you have rightly said epidemiology is now coming into the forefront. Epidemiology is not always about the infectious disease. It is even epidemiology of disaster could be there. In all kinds of disaster, we can learn epidemiology. Epidemiology is beyond, I think, just a particular disease. Even we can talk about the health, why the health is there. So uh, I think everybody should learn about epidemiology. So it makes you more scientific. So you rightly said that what is the development going on and how the NIDM is working on it, and what expectation is there at the national level, and how preparedness is going on. So now I'm coming to the next speaker, and Ritu is there. Dr. Ritu Singh Chauhan. She's the National Professional Officer at WHO. She's an international health expert with 15 years of experience in WHO, working in policy and strategy and planning, program evaluation, capacity building, strategy, risk communication for preparedness and response to outbreak and public health emergency in particular, that of high threats, pathogens, and business continuity planning. That's very, very important. So with the sound influencing and in negotiation skills in global health issues, Dr. Chauhan has demonstrated track records of working with policymakers and partners at national and subnational level in India. Presently actively involved in COVID-19 response in India as part of WHO health emergency team. She's going to talk about what is the role of WHO in COVID, in coordinating response to the epidemic which is going on, and how they can help us to have the vaccination in line as far as the stock piling of the vaccine is concerned, and delivery of vaccine, and because they have vast experience of our successful polio program. So we are looking forward, and up to Ritu.
Thank you very much, sir, for the kind introduction, and greetings to all from the World Health Organization. It's my proud privilege to be part of this webinar, and thank you, Sphere and NIDM, for organizing this on the first International Day of Epidemic Preparedness. And as we know, that this year has been very unprecedented, and with the COVID-19 really disrupting lives and livelihoods of people, with the impact of the pandemic reaching far beyond health. So I have a couple of slides, and if Sphere can just project my slides, I'll try to cover a few issues that we have been grappling with this year. Can you put it in slideshow mode, Pangni? Yeah, okay. If you can put it in slideshow mode, it'll be nice.
Yes, I'll just. Yeah.
Thank you very much. So friends, as we celebrate the first International Day of Epidemic Preparedness, and what a year it has been, and we find that why this unprecedented event has happened also makes us think about what are some of the risk drivers which the world is facing today, and which is why the emergence of high threat pathogens becomes absolutely very critical to understand for us as global community, but also to look at in terms of preparing for future outbreaks and pandemics. As we know, this world is changing, and very fast, with very fast international travel, unplanned urbanization. In many cases, public health infrastructure is weak. health systems and supply chains are weak. Microbes are adapting at a very fast level. One of the challenges that we have to live with is how to live safely with animals. And we have seen how wet markets and living safely with animals has been one of the major concerns, with one zoonotic event happening every year, one big zoonotic event, one new disease emerging every year. We are also staring at emerging global, antimicrobial resistance and a lot of cases of spillover events from one species to another to man. And with overall climate change, environmental degradation, we understand that there are huge concerns to global public health security. And when we look at all these drivers, it makes us, think in terms of how do we better plan for prevention of some of these bigger outbreaks and pandemics, and what are some of the modeling tools that we have? What is it that we need to understand in terms of what is changing of our world, and how can we prepare for it better? Next slide, please. So, as we know, this pandemic has underscored the importance of investment in systems to prevent, detect, and respond to infectious disease outbreaks. And in this picture, this was one of our first trainings jointly with the Ministry of Health, looking at the national response to the overall COVID-19 pandemic. And this was a training of trainers in which we had all state representatives, and we know exactly same time, December 2019, we had just finished with training of the Ebola rapid response teams, and that came in very handy in terms of activating the response. So when we really talk about preparedness, it is during peacetime. Countries have to utilize the time that they have in terms of investments in preparedness. And without preparedness, there cannot be sufficient resilience in terms of mounting the kind of response that we've had to see with overwhelming health systems, bringing the whole of society together, everyone having to contribute. So pandemics do take a huge toll on the overall health systems of a country, and we know how difficult this year has been for the entire world. Next slide, please. So it's very important for us to understand what are some of the lessons from the recent global outbreaks. And we know that these high threat pathogens will continue to happen. This is not the end of it all. We have to prepare for more to come. And the health security threats that we have seen with SARS, H5N1, influenza, 2009 pandemic, other events, other subtypes of influenza appearing in animals, the Middle East coronavirus, Ebola, which became such a big event in West Africa, and then again in DRC. We know that zoonotic diseases in particular do keep coming back. And therefore, as I mentioned, the risk drivers need to be better understood. As I have talked about, investments in preparedness during peacetime does involve a huge set of activities, a whole national system of response and planning. And when we talk about strengthening the systems for international health regulations, we talk about having a national action plan for health security, which should really look at preparedness for such events. And the best chance to really contain a new or emerging disease is right when it surfaces. As we know, the initial period of any emergence of a new disease is really the most important time that we have at hand, and one that should enable the whole of society to look at how do we stem it right there. As we have seen with this pandemic, how important community engagement has become. Right in the beginning of the pandemic, there was so much fear with this being a new disease. And we know that sometimes fear can spread very, very quickly, much faster than the disease itself. And we saw in the initial period how important it became for the government to call upon all partners to stem stigma and some of the other social dimensions of the disease also that we had to tackle with. And we know this vulnerability is not exclusive to our country, this is universal, and the world is really fragile. So we're really looking at a shared responsibility. We need strong national systems, but we also need very strong local capacities, because we know that the health gains can be very easily reversed when built on fragile health systems. So really, in terms of understanding what kind of response is needed, the action really has to happen at the local level. Next slide, please. So when we talk about tackling emerging threats in the future, and we look at this, the the magazine Time had indicated much long ago that we are not ready for the next pandemic. And this is exactly what the COVID-19 has demonstrated, that unless you have good early detection and response capacities, unless the whole of the world is prepared, we are all vulnerable. So really there is a need for countries to help each other. And we are really looking at a time where we are talking about global solidarity. We're talking about countries helping each other in terms of even responding to the pandemic. And we have seen some huge examples of uh, global solidarity as well as nationalism appear during this pandemic, with often political dimensions to it that one needs to be cognizant of. Next slide, please. So as the global health body with the mandate to provide the most updated, accurate advice on the pandemic, we have been garnering data and research from around the world. And we have, since the start of the pandemic, published more than 100 technical documents on the disease itself. This being a new disease, the member states really looked at what was the emerging guidance coming from WHO with so much, even we were having to look at the emerging data around the disease in terms of providing the most updated and the most scientific advice on the disease transmission, looking at the important components of strengthening surveillance, laboratory diagnosis, infection prevention and control, protecting healthcare workers, risk communication and community engagement, as well as whole of society response. So we have issued guidance that has benefited member states, communities, workplaces, institutions, private sector. We are continuously updating our situation update. We're trying to make people understand what is it that we really have brought together a lot of technical experts and guidance to look at what is the most updated advice around this disease in terms of mounting the overall response to it. Next slide, please. So I'm sure all of us have been looking at the latest situation updates from WHO, and we are also now working extensively with vaccine manufacturers, with COVID vaccine facility. And we know that vaccines moving forward will be a key tool for suppressing the spread of COVID-19. But until such time, we do have to take care of all the necessary measures. And we are still talking about, the 3 C's: cover your face, keep your distance, and hand washing. It's very, very important. And we need to continue to talk about COVID appropriate behaviors, because we know even when the vaccines arrive, there will be priority groups, there will be limited access, and one needs to take cognizance of all these facts. Next slide, please. Another slide, please. Next one, please. I'll come back to this one. So as I said, that we have been preparing for vaccine deployment and planning, and a number of our field team staff are also supporting the states in developing and preparing the states for the vaccine deployment and vaccination plan. And there is an overall operational plan which the WHO has helped develop together with the Ministry of Health. And our focus is on equitable access to vaccination, but also looking at the safety and efficacy aspects of it. We are also working with the regulatory authorities to ensure that when the vaccine is actually there, the rollout of the vaccine can happen with the proper regulatory approvals, etc. So there is a whole lot of global guidance which has come out on the vaccination deployment and planning. And there are also tabletop exercises. You can look up the open WHO website, and you can look at how different members and stakeholders are being prepared, especially in terms of rollout of the vaccinations. Next slide, please. So in terms of the overall response to the COVID-19 pandemic, it's been a very busy year for us in India, with country office supporting a large number of initiatives together and jointly with the Ministry of Health. Of course, our most important and our clear role being providing strategic guidance and advice to the Ministry of Health. And we have been continuously being part of Ministry of Health joint monitoring group meetings and other meetings which have been held specifically for COVID-19 response, but also in terms of looking at periodic risk assessments to advise the government on what kind of public health and social measures need to be mounted. Our entire field surveillance staff at this time has been repurposed for COVID and is supporting the states for COVID-19 response, including contact tracing, enhancing surveillance, containment activities, supporting laboratory guidance and other supplies together with ICMR and NCDC. As I said, we are working a lot on now vaccine preparedness activities with the states. And a lot of work has also gone in terms of development of materials for risk communication, community engagement. And we know IEC is not just leaflets and pamphlets, and we really had to work together with the Ministry of Health and a large number of partner agencies. And we have led the UN response on COVID-19 pandemic, including that of addressing stigma and some of the other social and mental health dimensions linked to this particular pandemic. So as I said, regulatory approvals in particular for diagnostics, therapeutics, and vaccines also remains an important area for our support, but we are supporting the ministry also in capacity building. Large number of training programs have been conducted, including looking at interdisciplinary research activities, and a number of research partners have been identified, and the solidarity trial is also ongoing at the global level, to which India is contributing heavily. We have in this pandemic also brought the whole of society together, and we've been working with private sector, civil society, NGOs, CSOs, with COVID Academy being just one example, but we have had many other partnerships with FICCI, some of the other associations, Indian Medical Association, some of the others who have also contributed very actively to the overall response of the pandemic. And several of familiar faces I have seen who have joined here, particularly welcome UNICEF colleagues, Dr. Vivek, with whom we have worked very actively during the COVID-19 pandemic right from the start. Next slide, please. So as we know, as UN agencies, our business is also to make sure that the marginalized and most vulnerable people are also included in the entire planning and response component of the COVID-19. And we have been looking at addressing some of these aspects as well in terms of preparedness. And we know that risk communication and community engagement in particular becomes very important, and we have to reach the last mile and make everybody a part of the overall response pillar. Next slide, please. So as I said, we have talked about a lot in global solidarity, social cohesion, being, promoting kindness and empathy during this pandemic, because we know this had so many the impact of the pandemic has been on the mental health and emotional well-being, and the trainings that we have conducted for the telecallers, 1075 radio jockeys, champions, those who have been partnering with us in the COVID-19 response. We have really seen that the pandemic also brought to the fore issues of, people going into depression, coming down with various issues, especially during the lockdown period. There has been a lot of emotional also toll that this pandemic has taken on people. And this was really the time which has brought the whole of society together. And we've been talking a lot about ensuring that we help each other, we use kind words, we support each other during this very difficult time. And as WHO works with member states, I think this is a role which everybody can play, including especially the civil society, which we have actively garnered support from in terms of ensuring that communities are well protected and they are well aware of how to manage their own health, including mental health during this particular period. Next slide, please. So as we know that this is not the last, major high pathogen threat, and we know that the overall planning and review process has to be continuously supported. So we have been working with member states right from the beginning, and countries that had been investing in influenza pandemic preparedness plans found themselves better ready and able to galvanize the necessary support that was needed for COVID-19 response. So a lot of our work goes on for strengthening international health regulations, including the core capacities, ensuring that these capacities are well in place, the contingency plans are ready, they are tested, they are utilized. After action reviews, and this is really the time we are recommending countries to go forward with after action reviews, and we have been working also at working with states to ensure that states are able to carry out their after action review. The after action review provides opportunity for the member state or the state to look at what worked well, what did not work well, what can be improved if there were to be a similar event or a further surge, and really puts forward the recommendations that can be actioned upon by the state to ensure that the readiness plan is in place. Right now, I think countries are also looking to move forward. Thailand just concluded one business continuity planning for all its healthcare institutions. So we are looking at different exercises, functional testing to ensure that the plans should be there. The plans need to be revised and acted upon so that the next time there is such an event, we can have a better planning and preparedness for this. Next slide, please. Next, please. Sphere, are you working on changing the slide, please? Yes.
Yes, ma'am. Yes, ma'am.
Yeah. Okay. So this is a very important, consideration for us, the changing paradigm and what has to change when we talk about this important day of epidemic preparedness. The whole business of emergency risk management needs to change. We have to move from an event-based scenario to a risk-based scenario. We have to move from a reactive to a proactive approach. We have to move towards an all-hazard response and a multi-sectoral response with shared responsibility of health systems. We have to work with communities. We have to ensure that the risks are calibrated from time to time. And therefore, this really needs a lot of training in risk assessment and planning, which we are also looking at in terms of working with India now to support at different levels, both state and district. And we are looking to have a lot of support also from partners in terms of taking forward emergency risk management for health, because this is going to be a very, very important agenda for global health, but also for us here in India. Next slide, please. Just right click, it should happen. Yes. So with this slide, I'll try to conclude. And what we are really talking for today is 3 Ps: prepare, prevent, and partner. Because without partnership, really, the countries, member states, the local districts will not be able to garner the necessary response and readiness which is needed. And we need partnership from multiple people. As you can see in the list, we are talking about a multi-sectoral partnership collaboration. WHO is working with other UN agencies as well as member states, but countries need to work with line ministries. And we have also seen this in this COVID pandemic, how different ministries have come together to play their roles. And also as well as development partners and donors, especially in countries which may find themselves difficult to sustain the national action plans without donor support. We're really talking about financial institutions also to come forward and support. We're talking about a whole of society response, so private sector, academia, NGOs. Dr. Jugal was mentioning about associations, but we have also seen that influencers, members of parliament, Ministry of Finance, other sectors, how trade and tourism play such an important role in the whole scenario of lockdowns. We have seen how important, the impact of some of these sectors has been. So we know that when all the sectors come together and contribute as partners, only then shall we be able to have the necessary resilience and response to prevention and mitigation of some of these outbreaks of high threat potential. Next.
So you can
are looking at the 3 billion for the world to achieve the sustainable development goals, for which our target is 2023. Let not the COVID-19 derail ourselves in this goal. So we really have to talk about continuity of essential health services, strengthening of primary health systems, and ensuring universal health coverage. Without these, we will not be able to prevent, detect, and mitigate the effect of outbreaks on this world. And I stop here. We need to promote health, keep the world safe, and serve the vulnerable. Thank you very much for this opportunity. Over to you, Sphere.
Thank you, Ritu. You rightly said that the WHO is producing a lot of guidelines And with the help of ministries, a lot of information has been generated. Also, you referred many documents and which are useful, and rightly said that prepared, prevent, and partnership is very, very crucial. And you also touched upon some of the marginalized section of society which require attention. We are running short of time. I'll request all the resource person to decrease their, at least 2 minutes. That would be very nice. Next is our Vivek Singh, Dr. Vivek Singh. He's a health specialist in UNICEF. He's uh, um, he's a supporting the chief of health in the effective management of UNICEF health program in India. He has 20 years of global experience working with the public health department, academia, and WHO UNICEF. He has worked in public health emergency for the strengthening immunization and public health surveillance system globally. He is a co-editor of the book titled Transforming Public Health Surveillance. He holds an adjunct faculty appointment at the Hubbard Department of Global Health, uh, Rulin, a School of Public Health in Emory University. Dr. Vivek is also an invited member of the Indian Council of Medical Research Task Force of the COVID-19. He's going to talk about the scope of improving for enhancing the current public health system in India and how this can prepared for the next pandemic. It's a very important topic. Looking forward, sir.
Thank you, Professor Jugal Kishore, sir, and humbled by the introduction. So, first of all, my heartiest wishes to the group for thinking of this event today on the first ever, as the predecessors have said, first ever day which is dedicated to epidemic preparedness. And COVID has brought to the fore the importance of preventing or preparing for or responding to such emergencies. So, first of all, given the topic, let me highlight from the page where the UN has declared this as an International Day for Epidemic Preparedness, that what we need is more resilient and responsive health systems to be able to respond to such emergencies in future. And let me pick on these two words, that what do we mean by more resilient and more responsive health systems, and in terms of what actions we need to take as a country, and some of which are already being undertaken as we are mitigating the effects of the pandemic which is ongoing, but also preparing our systems for future. So for this, first of all, I want to highlight that given this platform by the Sphere COVID Academy, which is linking multi-sectorally the partners, the national institutions and emergency response and health, which is the core of any epidemic preparedness, as we have seen from the pandemic, and what is the need for the future. And within that, let me highlight that for health systems, what are the three main areas which are important for resilience and responsiveness? So first of all, when we say the health system, there are six essential building blocks, as we call, for the health system, which starts from the political will and governance at every level up to the front lines. Then is the financing of health system. So then is the issue of financing, that are we getting sustainable finance for reaching everyone with quality and equitable health services? And when we say reaching everyone, that reaching everyone with equity, that people who are in the farthest flung areas in the country have the same chance of getting the same quality of care as somebody like you and me in urbanized settings in slightly better off cities. Then there is the issue of the health workforce within the health system. And COVID has brought to the fore the importance of this one indispensable component of the health system. You can replenish ICU beds, you can make hospitals in the matter of 10 days, we saw in China and also in India. but you cannot replenish health workforce over night. So that is something which is a critical component. And then we know the supply chain of essential commodities across the health system. That's another important point. And within that, we just heard our colleague Dr. Ritu speak about vaccines, which is an essential health commodity. But how to make equitable access for vaccines, which is now going to come, how to make sure, and a lot of work is going on even for that in India, that how to make sure that those who need the most do not get left out and are the ones who benefit first. Then the health system building blocks is information systems, where the surveillance for diseases also comes in. So that's one area which will need transformational investments. So these are the building blocks of the health system. And then is the issue of engagement and empowerment of communities in health. So for resilient and responsive health system, what is very important as we move forward in India would be to strengthen the primary health care system for reaching universal health care goals within the country. And when we say investing in the primary healthcare systems, there are three interconnected and synergistic areas that define primary healthcare systems. And these are the first one, which is very important for us to understand. Then when we say strengthening primary health care systems, it does not just mean healthcare which is being provided at the PHCs or the frontline. What primary healthcare system means, and as WHO defines and differentiates between primary health system and primary care. So primary health system is involving whole of society for health. So that is how WHO defines primary health care. And how primary care is defined is the first point of contact for health services that is well coordinated, and that is provided continuously with quality. So that's the primary care. So, but when we say primary healthcare system, it means a health system which has primary care at the core of it, the essential public health functions at the core of it, but it is an integrated health service, which is primary, secondary, tertiary, and a good referral system linking all of these three seamlessly. The second important investment which will need to happen in the primary healthcare for UHC moving forward would be multi-sectoral policies and actions. So this is where, when Dr. Gupta was mentioning about One Health and engagement of multiple sectors for issues like climate change. So this is where the importance of multi-sectoral policies and actions that work at the determinants of health would become very important. And the third component of primary health care is empowering and engaging communities. That community is at the center of all the emergency preparedness that we do. And now what happens if the primary healthcare system is strengthened? How the health system becomes resilient? So there are three ways primary healthcare system investments give dividends. So first is they ensure the continuity of essential services. So for example, what the world had not seen, because this pandemic is once in a century like pandemic, what the world had not anticipated, I would say, is that the indirect impact of COVID. So we all are now seeing that the indirect impact of COVID, for instance, on children was more than the direct impact on children that suffered less than the other age groups because of the epidemiology of the virus we know. But the indirect impact of children who are sick and pregnant women who were likely to give rise to, who were likely to give birth during this pandemic period, they suffered a lot due to the effect of pandemic, both for demand and supply side reasons we all know. The demand had decreased because people were fearful of going to the hospitals, and that delayed sometimes seeking antenatal care. We all know that supply side, there was initially, as the world was, systems across the world were adapting, where the people would go who need essential services. There was a lot of confusion around that. Gradually, the guidelines were developed, and a lot of this indirect impact could be mitigated. But this is an important area and a function which primary healthcare systems perform, that they make sure that there is continuity of essential life-saving services during epidemics. The second important function which a strengthened primary healthcare system takes care of is identifying and managing the emergency cases. And that is very important in epidemics if we want to decrease the mortality, that timely identification and management of the cases that are to be prioritized. And the third function which primary healthcare system investments they play is ensuring that there is good disease surveillance and timely prevention of or preparedness for or response to any epidemic, starting from the front lines. And why this is all important is that, as my predecessor, Dr. Ritu, also mentioned, that for health security, that is for ensuring that diseases that have epidemic potential are detected in time and these are prevented, and for whatever epidemics that happened, the response and mitigation efforts are effective. So it is important for health systems to have good information systems, surveillance systems that can identify and that can prepare the systems and can create responses to epidemics rapidly. So these are some of the areas of work where government has already begun. And just to exemplify, I would pick on two examples. What is being realized through this pandemic is that there are good schemes which the government had started building up to the National Health Policy of 2017 and beyond. For example, if you talk of Ayushman Bharat and PMJ, the realization that the 100 million target that was to be reached, and by now about 10 to 20% of that target has been reached, how effective this was for making sure that those families who needed the care for COVID, were they actually benefiting from this? So this kind of assessment government has already started, and moving forward, for example, through the National Medical Commission, which was earlier the MCI, what are some of the transformative ways government can look at replenishing the human resource in time and their equitable distribution and retention? So there are various fronts on which the government has already started, and that is where I think we all partners here, the UN partners, the academia and the civil society and the national institutions in emergency response and disaster management, we have an opportunity to come together. And I would end by reminding all of us what the UN Secretary General had said when this day was being declared for emergency preparedness, that let us look at COVID as an opportunity as the year 2020 ends, and as an opportunity to build back better and a world which is more equitable and just. So looking at the rights of health for everyone, and which will definitely make sure that we prevent and we are better prepared to such emergencies in future. So thank you very much.
Vivek.
Back
Thank
to the
you.
chair, please.
Yeah, thank you, Vivek. You rightly said that health workforce is very important. Empowering community is also very important. And focusing on primary healthcare system in India is very, very important. You rightly said that in COVID-19, the child and mother suffer more than anybody else, although it is not shown anywhere. So, with these words, you rightly pointed out that the human resource development is very crucial, and we should do it. So we'll go next, and I request next speaker to take only just 7 minutes, and everybody if takes 7 or 6 minutes, I think would be much better. So the time will be available for some question answer, which would be much better than just speaking. So I request the next speaker is Carol Joseph, Dr. Carol Joseph. He has joined much earlier than us. So founder, director, and director health. World Vision India. He's a medical doctor, clinician, and public health expert in communicable disease, infectious disease, and prevention and control through strategic planning, management, program implementation, monitoring and evaluation, and operational research at various capacity in reputed international organizations like WHO, PSI, state health services in tuberculosis, HIV, and AIDS, sexual transmitted disease, reproductive tract infections for over 11 years. So you have a good experience of infectious disease, goal oriented, confident and thorough professional who can work independently or in coordination with the team effortlessly. So dear Carol Joseph, please, 7 minutes.
Thank you very much. Thanks, Spear, for giving this opportunity. It's really wonderful to be part of this wonderful team. I represent World Vision India as Director Health. So quickly, I have a few slides I will share. Uh, are you all able to see my screen?
Yes.
Yeah. So there are three questions posed. I'm just running through them. So yeah, just give me 1 second. Yeah. So just to give a brief, I know you all know about this, but to understand those questions, I think it's relevant to come up with this. So the original strain that was detected in Chinese city Wuhan is L strain, whereas now, over the past 10 months or past 1 year, it has been mutated into S strain at the beginning of 20, that was followed by V and G strains. So, in that particular aspect, the G strain has further yet mutated into GR, GH, and GV. Several other infrequent mutations were also there, which are altogether grouped as strain O. The G strain include one mutation that makes it easier for the spike protein on SARS-CoV-2 to bind to human receptors on human cells, potentially increase the chances of infection and transmissibility of the virus. So the G strain is considered as one of the dangerous strain. And the worrying part is it is not just in the humans, but it went into the human ecosystem also, even in the wild animals, in other aspects also. So that's making it even more difficult. So the original L strain is almost gone across the world, and the living G strain, the new dominant or the current strain for this pandemic. So coming up with what are the major mutations? There are more than 116 mutations as of now, but around 16 such mutations are in the humans as well as in the animal ecosystem. So out of these 16, that really had a potential to replace as a second wave or a second mutant virus. There are two strains in the GV. One is A222V, new mutant strain in the GV strain category, currently circulating in Europe. The more potential thing that has recently cropped up also is the DG614G. This now widespread mutation affects the virus spike protein and is believed to increase in infectiousness. So this is considered to replace the current pandemic. So G strains are the most dominant around the world. One such mutation that we are speaking and worried about is D61G4. You'll be hearing a lot about this in 2021. And the G strain is there in India even in July and September. We don't have a GV strain as of now, but the G strain is there even in India also. That is something I would like to stress upon. Yeah. So looking at the the trend of the past 1 year, where the original strain of L was there, then when did the S start, O start, V start? This is just a time trend showing the sample analysis of around 185,000 samples across the world. So currently in November, we are having GV strain as taking the whole world as a unit. This is where we stand. But looking at the impact of the new strain, a new strand of COVID on human life, we need to understand the survival strategies or the survival capability of COVID-19 over the past 1 year, how it survived and what are the different ways it can lead into. So, for example, if you look at the new strain has higher R naught of 0.5 to zero point 0.7 compared to a slight increase in R naught. So that is going to be, even the mathematical models of that even slightest increase is also showing really worrisome numbers as of now. So though it is just 0.02, zero point 0.2. So evolution, if you look at the disease, COVID is not known for hiding in and lurking in and slowly progressing. It decimates the human ecosystem very fast, human immune system very fast, and it tries to infect the person immunity head on and take the immune system to a right. So that is actually going to even the slightest are not, as well as the infectiousness is going to have a mild impact on that. So it is known for taking control of the immune system. So looking at the current survival strategies of COVID, these are the two ways we are expecting the infectiousness may lead to in these ways. Now, coming up to what are the impacts of COVID-19 new mutations, definitely vaccination is the only weapon we have. We will have to come up with vaccinations as much as possible. And the current vaccinations are broadly categorized into spike protein vaccinations and mRNA vaccinations. So the problem is just like the coronavirus is going to known for mutations. So currently for common cold, we have more than 6,000 viruses. So corona in the past 1 year have given more than 116 mutations. So every time you develop a vaccine, you are known to actually create a vaccine, and that vaccine may be not fully useful for the newer mutations. So like the new DG614G. So we will have to have frequent vaccination programs as well as frequent repeated vaccinations every few months. And within 3 months, you need to, maybe that vaccine strain or the vaccination will not be much effective. So that kind of a loop is pretty much possible in these aspects. So this also increases the risk of negative side effects like vaccine derived viruses, or that part is also down the line. We are not sure as of now. Now, looking at the new strains, what is the impact of morbidity and mortality or overall health? Yes, it can spread faster. We keep looking at the infectiousness, but the disease is pretty much known how to handle by most of the doctors across the world now. But overwhelming numbers and the disease duration, if it comes down to maybe 7 days or 10 days, we are yet to see what is the disease duration, how it's going to impact. So we'll be worried only if the disease duration and the infectiousness keeps on. Otherwise, the pretty numbers are pretty much going to be the same, and which our doctors are well aware and handling it. So if the numbers are overwhelmingly coming up because of the infectiousness, and if we don't take lockdown measures seriously and prevention measures, we might see higher numbers as well. And that may lead to higher mortality, looking at the proportion of infection people. And looking at not just health and infectiousness, looking at fear and misinformation will create havoc in 2021 because of the vaccines and the vaccine at which they are, the scale at which they are pumped in, and individual countries are pumping in vaccinations and submitting for DGCI. So they will have a lot of counter misinformation is going to be very critical for a country like India. And you will see some knee-jerk responses, and regional lockdowns might happen, will be the new normal in 2021 that I think we are used to right now. So we'll take appropriate measures. Still, social distancing and face masking will remain successful public health preventive measures. So other than that, the new vaccines may not really impact much, looking at the disease duration and characteristics. Now, the second question is effectiveness of vaccine after the virus has already started mutating itself. I answered a little bit of it in the first question. Frequent vaccinations may be advised to boost host immune response every 3 months. Likely possibility is there. So you will be used to getting frequent vaccinations, that's something we will have to deal with it. If we are dealing with new strain of COVID-19, altogether the spike protein vaccines will be ineffective. But please remember, uh, the original strain has locked the whole world. We cannot undermine it. The vaccine is even useful for that original strain. A lot of people have not been infected. Definitely, the spike proteins are going to be very much useful, or the vaccine is developed for that is going to be useful. Whereas mRNA vaccines have better impact, looking at the science and the technology at which they were developed. As of now, there are no way of knowing effectiveness on drugs and vaccines on new strains until they really resurface. So the only reliable source we have to look up and keep up ourselves updated is look at the CEPI, creates a new collaborative workforce, and it is analyzing the data. So we need to keep our fingers crossed and look at the data, how that is going to showcase in the next 2-3 months. So not just 2 3 months, next year. Now, looking at the third question, can herd immunity be achieved for a populated country like India for pandemics such as COVID-19? It is difficult to attain herd immunity for COVID-19 due to rapid mutations. Definitely, that's not going to be feasible. But there are two pathways that we can think of. One is for reaching herd immunity. One is vaccination. The other is through natural infection. But looking at vaccination is the only strategy we have. We cannot go ahead with natural infection because looking at the mortality of even 1% in India, if we overwhelm our own medical resources, which we have been straining for the past 1 year, I think even the new transmissible virus strains are also going to overwhelm our health system, and the disease is going to cause more deaths. So natural history of natural infections is not the route we choose to reach herd immunity. I think we have to rely only on vaccinations. Thank you very much, sir.
Thank you, Joseph. Dr. Joseph, you rightly said that there are a lot of mutation, and almost I think 2 mutation per month has been witnessed, and and this 116 mutation is a good information you have given. Very nice. Without wasting time, we directly go to Dr. Ravi Kant Singh, who is a founder of Doctor for You, and he's a founder of a non-profit organization, Doctor for You, in Pan India organization, which is leading medical humanitarian organization of India. He's also assistant professor at Tata Memorial Center, Mumbai, since 2019 onward. He's leader and specialist in the development of public health system for emergency preparedness and response capacity across India and South Asia country. He has also worked in public health sector workforce development for emergency response and multi-drug resistance tuberculosis in India. He is the first and only Indian to receive South Asian Association for Regional Cooperation Award for outstanding work in the aftermath of disaster in 2010. His topic of discussion is dynamics of infectious disease in human and animal. So looking forward, sir. And again, time is only 7 minutes, please.
Yes, sir. Yes, sir. And thank you so much. I am so delighted to know that you are moderating. And for the people who don't know about Jugal Kishore, I can just tell you that sir की book पढ़े बिना कोई MD की डिग्री नहीं मिल सकता है तो इनकी बुक पढ़ करके ही मैं आज MD बना हूँ. So I'm very very thankful to Sphere India and NIDM to arrange this call, and they quickly like 7th को ये डेट डिक्लेयर किया UN ने, और आज 20 days means we are doing this webinar. So excellent. We need this kind of rapid response during the time of crisis. So as Ritu also said that we see one outbreak almost every year. There are 2 spillover यानी animal से human में hello, can you hear me?
Yeah, please continue. Please continue.
Okay. हाँ, so one outbreak, two spillover, and almost 5,000 disease alert every year. This is WHO data we receive every year. So you can see the how vulnerable we are. If you see in last 20 years, we have more than 7-8 major outbreak, including this the COVID, and just 2 years back in Kerala, आप लोगों को याद होगा निफा outbreak भी हुआ था. So now the everybody is talking now more than universal health. Now this one health approach is even more important. अभी तक like our major focus on human health, हमारे क्या होगा, हमारे बच्चों का क्या होगा, but we never think कि animals का क्या हो रहा है, उनके बच्चों का क्या हो रहा है, and what we are doing with our environment. You will be surprised to know that almost every day 200 species are totally extinct forever on this planet, but nobody is worried. And now आज like आदमी मर रहे हैं, we are dying, our relatives are dying, so we are so worried. So this is a high time that we should now think seriously about the animal health as well as the environmental health. Rapid deforestation is the major reason why this kind of outbreak is happening. And to your surprise, almost 30% deforestation जो हो रहा है sir, it is happening because of the tea plantation. So this tea, coffee, and sugarcane plantation, and the cotton to generate more cotton, we are destroying the forest. So we are into very, very dangerous phase, and if we don't change our path, we are going to see many more disaster. And as written here, like the diseases travel very fast. If you see this UK strain, immediately within 2 days, like the whole world is alert and now testing. So according to CDC simulation, they said that we need just 36 hours for a spread of one virus to from one country to other country. We still don't know about more than 10 lakh viruses. We can't predict the exact date and time, but we know कि hotspot कौन सारे हैं. Like if you see in India, we know Kerala, Bengal ka, Bangladesh ka border, this area is very hot spot, very biodiverse, and if we keep cutting the jungles, we are going to see this. Then rats and bats, चूहा और चमगादड़, ये दो major danger है which spread the disease. Bats constitute almost 22%, and उनके शरीर में वायरस ही भरा रहता है, आप यही समझ लीजिए. And rats you see in the सूरत में भी जो प्लेग हुआ था, and अभी because of planned urbanization and slum जो है, rat population is increasing drastically everywhere. So so these are the two major then. And ये भी नहीं है कि ये तो चाइना वाला वायरस है, it can come arrive at your country or your doorstep any time. So what we need to do for to prepare ourselves for next pandemic, resilient public health. I think सब लोगों ने, ये मैं कुछ भी बोलने वाला नहीं हूँ इसमें, कि everybody know that unless until we have a strong public health system, we can't control. Prepared for the worst and rapid response. आपने देखा this time we were all preparing for the talking about COVID, and suddenly Calcutta cyclone and Mumbai surprisingly affected also. Immediately, एक रात में we have to shift hundreds of patients from Bandra Kurla complex makeshift hospital to different hospital. So we have to prepare for. ऐसा नहीं है कि एक disaster एक समय. We can get multiple disasters simultaneously, and without dedicated fund for the public health and pandemic preparedness, we can do lots of discussion, seminar, webinar, but unless until government and public health पे पैसा खर्च नहीं करेगी and is separate from the health budget for preparedness, we are not going to see any change. The last thing is responsible leadership. But like in US, fortunately, we have the Dr. Fauci. But yaha, in India, if you ask who is managing the, unfortunately, we can't say who is actually leading the crisis. In fact, currently, if you see in NDMA also, we don't have a single public health person there as a leadership position. I know out of 3 members, none is from public health background. So the leadership is very important. They have the subject expertise. आज के दिन सर you know all are becoming epidemiologist and epidemiologist को कोई पूछ नहीं रहा. So that also is a very big issue. Then these are the thing I think already many people have covered this, so I won't go. And this is my last slide, that the leadership is the key. Strengthening public health system is the key. We need to dedicate the separate budget for if we want to prepare ourselves for the next pandemic. And the climate change is huge. It's changing our life in a big way. We have to change our life to be a more simple, sustainable and humble life, and not very consumeristic lifestyle. Thank you, sir.
Yeah, Dr. Ravi Kant, you rightly said that very good leadership is required, and you all are becoming leader. So we have great hope.
Thank you, sir.
Thank you for your presentation. Next speaker is our Dr. Chandrasekhar Pandey. He is a program director in Child Fund India. He is currently working in program director with Child Fund India. He has more than 25 years of experience with national and international NGOs for managing child development program across 14 states of India in partnership with civil society organization, health, ICDS department, bilateral agency and academic institution. He has major contribution in policy and planning for reproductive and child health, including early childhood care and development. Mr. Pandey has introduced unique community-based nutrition model, health intervention for maternal and newborn supporting first 1,000 days of life. He also supported government of Jharkhand in designing of community-based mapping tools, part of the WHO new growth charts and part of early learning development standard tools, track age appropriate development milestone for the children at Anganwadi Center. So he has a very good field-based, research-based experience. So welcome, sir. You are going to talk about how the interlinkage between epidemic, food, nutrition, and immunity system, they have to play a role in effective management of epidemic. You, sir.
Thank you so much, sir. And greeting from Child Fund India to everyone. And I was so happy to hear all the panelists bringing so much of information. And in the meantime, I was calculating so that even the vaccines arrives, and then after suppose it is given to each of the individual, even I consider the 60% of the population, not all the population, with the current public health system, it will take 6 years time. So definitely the capacity can be increased and it can reaches early, but this is the current capacity. I was calculating that one. So why the nutrition is important? That's why nutrition is important, that nutrition play a very critical role in managing any kind of illnesses, and particularly in current situations. If you see that if it's all type of infections, even the viral infections can be managed through the better nutrition. And if I talked about few of the nutrients, particularly the micronutrient, I will only think the advice about it is very simple to know about A, B, C, D, E. If we talk about only 5 micronutrients, and this all helps in actually increase the immunity of our system. Like vitamin A, earlier a lot of talk was about the night blindness, but meta-analysis that conducted recently, and that has also talked about that it reduces 23% of all cause mortality. So this, if you look into the vitamin A, is also the one of the important factors. If you also think about vitamin B, that regulates our intestine and immune system. Vitamin C, it is a carrier. So now also, even in the COVID, it is suggested that vitamin C must be taken. Vitamin D and E both actually reduce the respiratory, upper respiratory infections. So if we talk about these 5 types of vitamins and how much it is helpful, and if you are talking about some of the trace elements like zinc, coppers, iron, so these are again the trace elements that is also important for our body. So what we have done recently, we have introduced even in TB, this nutrition works very well. In Madhya Pradesh, we introduced one of the impact bond that is on 1,000 TB patient, and then after when the nutrition component was given to the TB patient, it was working so well, and then after it is supplemented by the public health system. So most of the situation and the scenario, you have seen that this with nutrition, even the any kind of serious disease, illness, it provides the immunity, and this is the things that it can reduce and viral load, and medicine can also work better in that situation. Even I can say that in Child Fund India, we researched to around 3.5 million children in 14 states of India. And there also we have seen that none of the children are impacted seriously with this COVID. Some of the incidences we got it in some of the locations, but none of this translated into severe cases. And in the beginning, when the COVID introduced, that only we focused in the initial period on the nutrition. So nutrition is such a component that it need to be introduced, and if the nutrition is introduced, then after the immunity, it increases the immunity, and then only any kind of vaccines, and this is the easier thing that will work in a much better way. So that's why we see that it is a public health system. The nutrition focus is important to increase our immunity. I'm not going to take much time because of the crisis of time. Even the next part also is how effectively it can be managed. Then we have to go a little bit of detail that how this means be micronutrient and vitamins can be obtained. So maybe we need to understand a little bit more about what are the various sources of vitamins in our. So the first sources we say the dietary diversifications. So what are the diets need to be consumed which are rich in these vitamins? So that we have to see. Second is the fortifications. So many of the European countries, they have control on the fortifications. So I'm not only advising only one thing, but also to look into the fortified items, which can be easily, particularly in the urban locations, the many fortified products are available. In milk also, you see the vitamin A are also fortified with vitamin A milk. The oils are also fortified. So these are the things we can see about maybe the second part. And third part is supplementation. So supplementation is also important for various age group who cannot digest even the raw materials, particularly the high age group populations. For them, it is very, very important that also to take some kind of vitamin A supplements, particularly rich in 5 micronutrients and some of the trace elements. That is important to fight this COVID and this kind of viral situations, because this is going to continue and we need to find the sustainable solutions. So that's why I'm coming from community-based nutrition background, and based on that, these are some of the practical experience which I have shared with you. Thank you so much.
Thank you, Dr. Chandrasekhar. Very nicely placed that nutrition is very important. I am just looking at the chat box and I'm not finding any question. Anybody wants to ask any question from a resource person? Hello? I think everybody is happy with the presentation. Indeed, because the presentation is done
Sir,
by.
I think Anuradha has a question.
Okay, okay.
Miss Anuradha requesting you to unmute yourself and ask your question.
Yeah, Anuradha, please. Hello. Okay, Sharanapa Barsi is also raised hand. He can also ask question if Anuradha is not asking. Sharanappa.
Hello.
Yes, yes.
Can you hear me now, sir?
Yes, yes.
I'm Anuradha from Prithvi Innovations. Thank you very much for organizing this very informative and very useful session with so many eminent panelists from various organizations. My question is to Dr. Chandrasekhar ji. I think he very rightly pointed out the need to increase our immunity system through improving our nutritional like diet plans and moving towards more sustainable diet options. So I would just like to know from him, if sir, if you could highlight and kindly share your thoughts about the nutrient value of the microgreens. The microgreens have become a very like increasing concept in these days. And do you really feel that if we all can supplement our food with microgreens, will it also help us a lot in improving our immunity system? And because it can be easily given to the marginalized communities also, they can also easily take it and like have it on a regular basis. So I would like your thoughts on this. Thank you very much.
Thanks, Anuradha, for raising your concerns. So I'm not eat a product. I'm not in favor of any kind of product for the marginalized community, because then after it can be with any of the community they have. If you go into the local area, they have a lot of nutrient rich means diet is available, but they do not aware about that. Because once I was in Madhya Pradesh and I was working in Jhabua in very tribal belt, and I saw that the lot of soybean actually produced in those region, and they do not know what means. It is a protein rich diet, but they do not aware about it is a high rich in the protein content. So basically what is important to know that you need to identify, to study the local community and the vulnerable community, and to identify the what are the protein rich contents are available, and that need to be promoted. The red pumpkin, I seen that in one of the locations, it is so easily available, and red pumpkin has vitamin A, vitamin B. So a lot of nutrients which you can get from the fruits, you can only get from the red pumpkin only. So I think better to, I will always suggest to promote the locally available nutrients which are required and which is easily available, so that they can consume easily. So that can definitely promote.
Okay. Okay, Chandrasekhar. Very nicely
Thank
put.
you.
Yeah, any other question? Sharangi, should I wind up? Sangavi.
Yeah, I think so, sir.
Okay, I'll take just 1 or
We
2
don't have any
minutes.
more questions, I think.
Yeah,
Yeah.
speaker have given very nice presentation and new information, particularly the mutation part of the virus and how it is affecting our vaccine, and which is the major concern today, whether the current vaccine is going to be useful or not, and then supporting statements by all the NGOs and international bodies. Saranappa, you want to ask any question? You have to unmute yourself.
Okay. Sir, good afternoon.
Jay.
Hello.
Yes, speak.
Sharanappa, I'm running a NGO Sadhana Raichur in Karnataka. So
Okay.
I am asking one question, Ritu Madam, that WHO is having any any preventive measures on migrant workers. So migrant workers is very facing the crucial problem to face this epidemic, and also new virus is arises. And another question, Spare India is take role to any innovative intervention programs to migrant workers with help of WHO and UNICEF, some government of India. So this is my question, sir.
Yeah, very nice question and very difficult question also. Ritu is there? Dr. Ritu? Okay, Sphere India, would you like to say something on this? Hello?
Hello.
Sir, if you want, can I answer that question?
Yes, yes.
Dr.
Yeah,
Karen, sir.
Yeah.
So we cannot have a separate strategy for migrants. We have to treat population as alike. But specific measures will continue to be important for all kinds of people. I definitely, if you ask what preventive measures, I mean, it cannot be said like that. It will work for every population. So that's going to be very important. Now, coming to some specific measures, I think more than the pandemic, I think our public health professionals will agree with me. We have estimated the pandemic, but we have never estimated the economic impact of the pandemic in 2020. So definitely, migrants will play a crucial role, and livelihood is going to be very impacted. They will reach out, controlling. We don't know the denominator, like how many migrants are there, where are they, what are they doing. If each and every state is not focusing on those specific data numbers, there is no way we can have a strategy to handle those migrant workers at a country level or at a state level. So NGOs, like all of us, we should have this confined compiled data of migrants first, at least. Then the same data can be extrapolated to at a state level. Then we can really work on some public health measures. Whatever the country comes up, we really don't know the denominator where they are. That is where we stand as of now. So over a period of time, definitely if we have those numbers, the strategy will be the same just for any general population. Yeah, I don't know I've answered the whole part, but that's very crucial. Migrant, we don't have denominator. NGOs need to capture those numbers, compile at a data repository at a state level, then become secondary level. Otherwise, we don't know what denominators we are playing with, what denominator requirements are. We are totally in a back foot in terms of migrants here. Thank you very much.
Okay, good, sir. I can take the data from our government of Karnataka. I am taking the responsibility, and others also take a responsible some respective states. And this platform you concentrating next one webinar, separate webinar. I think this is a very marginal groups, migrant workers. They are facing so many risks, and childrens also. So like that, I requesting to host organization to plan of action or strategy in future. Okay, sir. Thank you.
Your point of view is recorded. I think Sphere is going to work on it. How best can be done? Definitely, you said that migrant labor and worker is a big problem, and economic issues are, major issues, and because of that, the health is always affected. So rightly said. Okay, now in the end, just want to say that everybody has done.
Sir,
yeah.
I'm sorry to step in, sir. We have one more question.
Okay.
From Srishti Yadav. The question is why and who has declared it pandemic so late, or was it the right time to declare this as a pandemic scientifically?
Yeah. This has been debated.
So we have another...
Yeah. History.
Yeah. It was not like nobody know from day one that this is going to be pandemic. It always takes some time to declare any pandemic. So WHO, they are the best place agency to declare it, and I think from their part they definitely did their best in the given circumstances, and this is definitely a pandemic, and there is no doubt about that. But of course, anything happening in China is always like the some secrecy around that. So that might have created some confusion initially, but definitely it's a pandemic, and declare well in time, I would say. The only thing is the other nation, they should have taken it. They have taken it very lightly. They should have taken it very seriously, and then they started like the we lag behind in that time. We just watching what is happening in China, but we never thought that we should also start preparing for this pandemic. Thank you.
Yeah, Ravikant, you rightly said, and her question is also good because this concern was there, and this has been addressed by WHO and other agencies, and this has happened. Whenever we have a big pandemic, you always try to label culprit, so you can have some solace in you that it is because of this. So this is the question for that, but scientists should not work on it. We should always see that why there was a delay, and if there was delay, how it could have been uh, averted or better can be managed, and maybe in future how we can do it. So all boils down to the surveillance and the how robustic surveillance we can have at the national level or at the district level. So coming back to the preparedness, the epidemic preparedness is the only way we can predict the epidemic in future. And that is, the whole exercise today is that if we are prepared better, most probably we can do this job much faster. For that, we require funding, and funding has to be given by the governments and their all philanthropic societies. If they think their funding is going to be useful for the saving the lives of the people, then for that I think Ravikant has rightly said about the good leadership. So if you have a leadership in epidemic preparedness, I think can do wonders. We have challenge of the mutation of virus, and we rightly discuss about it, that how this mutation give rise to a problem and how we have to handle it. In surveillance, I'll say that private institutions play a very great role, not only just NGO, but I think all. And in India, we have 70-80% of our health is delivered by the private institution, and their role in surveillance is very, very crucial. And their involvement, need to be strategically placed, and they should be motivated to involve as much as possible. Uh, as far as the human resource in epidemics and research is concerned, then things are going on in India, and most probably, if we have the collaboration and partnership of all the non-governmental and governmental organization, I think we can have very good force, and we require hand-on training, and all has to work together to make a skillful epidemiologist, which is I think a challenge for us. And we have rightly discussed about the nutrition. He the Chandrasekhar has rightly said, and in this pandemic also we found that vitamin C and zinc was found to be the only method of giving the immunity, and again focusing on that. In all the discourse we used to say that balanced diet is very important to boost your immunity, so your immune system is very crucial. So with these words, I think one more point is the primary healthcare system need to be strengthened. Again and again, we are focusing on it, but our funding always goes to our tertiary care level health services. So if we can, strengthen further by providing infrastructure, would be more useful. So with these words, I thank Sphere India and NIDM for organizing this whole webinar, and it is found to be very, very useful, and giving this opportunity to have listen everybody and learning more about this mutation business, because the reporters are going to ask, how we can deal with. So I'll definitely refer Dr. Joseph. He can answer this question much better. So thank you very much, Isfair. If you have anything to say, please come forward. Thank you. Thank you, everyone.
Thank you, Kishore, sir.
Thank you, sir.
Thank
you,
you,
Rakanji.
Dr. Jugal, for effectively moderating this session. And
Yeah,
thank you to each
just want to
panelist.
say, yes, in the last,
Yes,
my
sir.
new book is coming.
Okay.
COVID-19. This is COVID-19 epidemiological and mental health challenges. Within a week time, we are going to have it. So you can find it in Amazon.
Thank you so much, sir. This is a great experience to hear you.
Okay, it's fair.
Yes, sir. Thank you so much, sir. And I want to thank each of the panelists for such an enriching discussion. Now, before we end the session, here are some administrative directions. Your certificates will be ready in 24 hours. You can visit our website, www.sphereindiacovid19academy.org, and you can download your certificate by scrolling down and finding the name for today's session. It will be ready to download in 24 hours. However, if you are not able to do so, you can, as participants have faced some technical difficulties before, so you can email us at covid19academy@sphereindia.org.in, and we will get back to you as soon as possible. Have a great evening and see you for the next session. Thank you so much.
Thank you. Thank you. Thank you, everybody.